A grim milestone. The death toll from Covid-19 is about to surpass 1 million people around the world. And there are fears that a second wave is just around the corner. Hello, I'm Arnold Naidu, and this is The Heat. Coronavirus deaths worldwide are near 1 million, most of them here in the United States. And more than 200,000 lives have been lost in the US. The outlook is dire for the country. Covid-19 infections rose in 21 states last week. It could impact schools reopening and the easing of restrictions. For the latest, let's go now to CGTN's White House correspondent Nathan King. Nathan, President Donald Trump addressed the issue today. What has he been saying?
Yeah, it's amazing that he had a very big press conference just behind me here on the South Lawn of the White House, actually in the Rose Garden. And basically everyone that was involved in the pandemic response, except Dr. Anthony Fauci, Dr. Deborah Birx, and the head of the Centers for Disease Control, Robert Redfield, who he's disagreed with, was there. Incredible that he's talking about the pandemic, where his numbers are down in polling for the election compared to his tax returns. But maybe that would be the better of two evils as far as he's concerned. And he's sort of reiterating this idea that a vaccine will be available soon. But he's moving away from the idea that one might be available before the November election. Let's take a listen.
My administration is on track to deliver a safe and effective vaccine in record time. Over 100 million doses will be available before the end of the year.
Yeah, well, 100 million doses, what does that mean? Both Anthony Fauci and other officials have said in the last 7 days or so that the most Americans, even if a vaccine is approved now, won't get it until the mid-2021. So this is very interesting that he's sort of concentrating on this response 5 weeks before election, yet we haven't seen a vaccine. We don't know when it's going to be delivered, and the numbers keep on climbing.
So Nathan, at a time when world leaders are talking about a very gloomy picture around the world, calling for more restrictions for people to use masks, for restrictions on when restaurants and bars close and things like that. Here we have President Trump sounding very optimistic. Is this more linked to the election than anything else?
I couldn't possibly say, Anand, but I think yes is the answer. I mean, essentially, he told this to Bob Woodward on tape, didn't he? He said, I like to downplay it, I don't want to create panic. But also there's an election consideration here. You know, this weekend, Florida, is still one of the hardest hit states. Rising cases in Florida, they've upped and down, have decided to open up bars and restaurants fully, giving a boost perhaps to the population in terms of them feeling good before an election, but the pandemic is still raging. Cases did dip below 50,000. They're now up towards 35, 40,000 a day, and the death rate, while below 1,000, is climbing back up. You know, this whole idea that it would go away in the summer and come back in the fall and the autumn has been disproved. Essentially, the US has been on a continuing curve for most of the summer. And this whole idea that it was isolated to blue states, as the president said, of New York and New Jersey and up north, has been disproved by the huge outbreaks in Texas and Florida and the Midwest. The question is, how will this affect him at the polls? The perception is that he is not valued for his leadership on COVID-19, and the message is not working. But it depends on which state you're voting in, of course.
Okay, Nathan, let me bring in the rest of our panelists. From Baltimore via Skype, Dr. William Moss is the Executive Director at the International Vaccine Access Center. And from New York, Dr. Calvin Sun is an emergency room physician and a professor in emergency medicine. Welcome to both of you. Calvin, let me start with you. You've been working in New York. We've been talking over the last few months. Case numbers are still rising there. The governor of the state, Andrew Cuomo, says the city cannot lower its guard. You've been working in those emergency rooms for a long time. What are you seeing right now?
There is two narratives that have been occurring during the past summer. One that is happening in New York City and the one in the rest of the country. I like to think New York City now as a city or an island off the coast of the mainland United States, because we've actually completely have recovered nearly recovered, nearly 0% positive since our first wave March and April. We are now, since of last week, beginning to see signs of a kindling in certain parts of New York City, not in Manhattan per se, but in certain parts of Brooklyn and Queens. These are isolated neighborhoods, and they could proceed into a second wave, but we have to wait and see. There are proactive steps to prevent by my colleagues working in those neighborhoods, as well as the shifts that I can do there. But there's only so much, and it's very hard to change ingrained habits.
So, Calvin, those proactive steps that you talk about, what are they doing?
Just encouraging them to remember and not have short-term memory loss what happened in their actual exact same communities in March and April. The people there who are part of the 5% positive, the rest of the city is less than 1% still, 1 to 2% at most. But those neighborhoods are 4 to 5%. That's a stark contrast, and the trend is trending towards something worse. We have to remind them that the people that died in high numbers were in those very same communities. These were their family members, people that they remember and they looked up to. Community leaders died of COVID-19. But it's, short-term memory loss is the thing of the theme of 2020, it seems, and some people just are quick to forget what happened and want to return to normal as soon as possible. And we just have to remind them to take precautions and to know that we're not completely out of the woods yet.
William Moss, I was looking at figures across the rest of the United States. There was an interview actually done by Dr. Chris Murray. It was on CNN, and he's from the University of Washington. He said that the United States could see a huge surge in the number of cases in October, that's just a few days away, where fatalities could jump from the current 765 a day to 3,000 a day. That's a triple-fold increase in the number of deaths. What do you make of that? Is that a likely scenario?
Well, I think that comes out of Chris Murray's models, and they've refined those models over time. I think what's driving those are a couple things. One is we have children and kids adolescents going back to school, going back to colleges, and we've already seen in the United States large outbreaks on college campuses. The other thing that's going to happen is that the weather's going to get cooler throughout much of the United States, and we're going to be spending more times indoors. And I think that, too, is going to allow for greater transmission from person to person as we spend more of our time indoors and cannot spend time outdoors. I'm particularly thinking of restaurants, and we want to be able to save the restaurant business. But as we move indoors in restaurants or whether it's theaters, we're going to see more transmission. And those kind of activities where people are coming together is what's going to drive this surge if we see that in the coming months.
Nathan, Calvin was telling us a moment ago of these very small resurgence in pockets in New York City, and I guess the challenge right now is to confine them to those pockets. But there have been protests in New York. Restaurant owners even staged a mock funeral of the city's hospitality industry, and you've lived in New York, you know what it's like over there. That's a key, crucial, vital industry for that city. How big a challenge is it to get New Yorkers to comply with these restrictions?
Well, actually, I think New Yorkers are complying pretty well in terms of masks and social distancing. The problem is, for restaurants, is they're used to being packed all the time. You've been in New York, you know that it takes an hour to get a table, even at your local restaurant sometimes. That is not happening. They've allowed restaurants to spill out onto the pavement. They've extended delivery and alcohol and all this, but it's not going to make up for stuff that doesn't exist anymore. And this is the problem. People are, especially as the stimulus goes away, people are suffering. Restaurants could fail. Your family restaurant may fail around the corner, and this is the problem. Now, of course, there have been protests, because essentially what's happened here is that, whoever you want to blame, whether you want to point the finger at the White House or you want to point the finger at CDC, this country has never got a handle on the virus since it started. It thinks it did, but it just spread around. There was no summer lull. There was no the hot weather killing it. We're about to enter a second phase, as our other guests have said, because of winter, because of the flu season. And we all know it's coming and it's going to get worse. And yet the problem is no one has recovered, either health-wise, economically-wise, or socially, from the first wave.
Calvin, this is quite a balancing act for public health authorities. what to ease, when to ease the restrictions without precipitating another wave. So what are the criteria that they would be looking for, say, in a big city like New York?
It's a balancing act, as you said. It's a combination of how to move life forward without completely opening the floodgates and setting yourself up for disaster. You fail to prepare, prepare to fail. We could look at Australia and completely obviate flu season making COVID even worse. And you can have COVID and flu at the same time. I nickname it Fluvid. And we can obviate that and actually make our lives easier if everybody in New York City continues their behavior of pushing forward, keeping the habits of face coverings, even outside, outdoor dining if that's possible during the winter, and everyone getting either flu shots or working with their primary doctor to get flu vaccinations, and trying to actually, if everyone keeps their masks and face coverings on, we may completely prevent the spread of flu and thus keep it just to COVID to focus on for the winter. These are all moving variables that we can focus on, as well as the societal aspects of outdoor dining and making and meeting the challenges that come up with certain neighborhoods and try to keep it to there.
Anna, can I just add something? I'm amazed that the United States knew it was coming to flu season, knew it had a test lacking capacity. My kids got flu shots this weekend. We really had to try hard to get them. That they don't combine a flu shot and a COVID test at the same time. That would have been possible, right? It's really quite incredible to me.
Dr. Moss, what are your thoughts on that?
Well, I agree that that we need to build trust in vaccines, and people need to get their flu vaccine. As Dr. Sun said, people can get infected with both viruses, and we're also worried about the healthcare system being overwhelmed with both COVID-19 cases and influenza cases. So we need to do a huge public health effort to ensure that large numbers of people, and particularly people at risk, are vaccinated against influenza.
Dr. Moss, where are we right now in terms of a vaccine? I mean, we hear lots of different timelines, some of which, well, especially here in the United States, are being driven more by politics than by science. But there is one alarming statement that came out of the World Health Organization, which is predicting that without concerted action, there could be up to 2 million deaths before we have an effective vaccine.
Yeah, so, I mean, there's no doubt that this has been a truly remarkable global effort, national effort to try to get a vaccine. The timelines here are much faster than it typically takes to develop a vaccine and get a vaccine to market, which is typically 5 to 10 years. But I also want to emphasize there are a number of things here that really have allowed the accelerated development of vaccines. One is that a number of the phases of clinical trials have been combined rather than done in sequence. We have manufacturing capacity being built up as the trials are being done. That doesn't happen under normal circumstances because that's a huge financial risk for vaccine manufacturers. And third, in the midst of a pandemic, there are just a lot of cases. So you can see differences between the vaccinated group in the phase 3 trials and the unvaccinated group. So all that's to say is that we can accelerate vaccine development and do it safely, do it rigorously, maintain the integrity, the scientific integrity of the trials. But what we don't want is we don't want politics interfering with the approval process and politics expediting the approval. My guess, I agree with Dr. Fauci and others that we probably won't have a vaccine for the general public until mid next year. Mid-2021, but there will be a vaccine doses available for frontline healthcare workers like Dr. Sun and others, and that could happen by the end of this year or early 2021.
Nathan, looking at the politics of this, I mean, would it be fair to say that ultimately the election, which is just over a month away, is going to be decided on this pandemic?
Well, I think you're right, both on the health aspect, but also on the economic aspect. My main worry when it comes to public perception of a vaccine is because, and look, I understand the rush to get a vaccine here. Certain red tapes have been cut through, but it's not just red tape. This is really stuff that the reason that pharmaceutical companies go through this so they don't get sued, and they're not going to be sued, is that it works. And my main worry is that there's going to be some sort of rush here, in the United States especially, I don't know about elsewhere, that has a vaccine that is maybe 50%, maybe less effective, but stops it, you see what I mean, in its tracks. And there's political concerns now. Now, there was a congressional hearing last week in the Senate where every one of Donald Trump's healthcare experts said, no, 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 no. But that's the opposite message we're hearing from here. And I really do feel that despite the best efforts of science here, the politics and also public fear may end up winning the day, and to perhaps the detriment of dealing with this long-term problem.
Calvin, very quickly, I've only got about 30 seconds. Seeing that the numbers have gone down in New York, has there been enough time, breathing space, literally, to build up the country's healthcare infrastructure, its capacity to take care of a second wave, if that should arise?
New York City, yes. I have my PPE ready. We're all on guard. I told all my hospitals I work in to keep their tents up, and they have. And we have all the mechanisms ready to prepare for COVID and God forbid, flu season at the same time. It will still overwhelm us because we were already overwhelmed way before COVID-19. But we have no choice, and we're going to just keep doing it until we collapse, and that's our attitude, because what more can we do in a year like 2020?
Right. And we have to leave this part of the program right now. Thanks to all of you for being with us. Let's turn our focus now to the rising numbers of COVID cases in Europe. The European Union's health commissioner warned that the continent is at a, quote, decisive point in dealing with its second wave of COVID-19 infections.
We cannot lower our guard. This crisis is not behind us.
The United Kingdom and France registered record numbers of daily infections of COVID-19 late last week, forcing both countries to enact restrictions. In the United Kingdom, masks will be mandatory for certain types of workers, and bars will have to close at 10 p.m. In some urban areas of France, including Paris, restaurants will have to close at 10 p.m., but in cities like Marseille, bars and restaurants must stay shut until further notice, which sparked protests. Many owners say they will have to close their businesses for good. To discuss the situation in Europe, let's bring in two new panelists. From Bath in the United Kingdom, Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter and an expert on communicable disease control. He joins us via Skype. Also via Skype from Paris, Maria Paula Carvalho is a journalist and author. Welcome to both of you. Bharat Pankhania, let me start with you. As I just said, the United Kingdom has imposed new restrictions. It is making the use of masks mandatory, and bars will have to close at 10 p.m. What are the factors driving these numbers up in the United Kingdom? And is this the feared second wave that we've been hearing about?
I very much think this is not a second wave, but a continuation of the first wave. It went up in March, April, May in the United Kingdom. Then it went down as we went into restrictions. And then as we came out of restrictions, and this is the key point, as we came out of restrictions, the baseline, the background number of cases in the country was a bit too high to have come out of restrictions too early. And then when you meet people who are vulnerable to infection, in other words, they've never been infected before, 92% of them have not been infected before, and there is a background level of viruses circulating. And then you start doing things like opening up businesses, going to work, opening up schools, opening up universities. You generate a number of cases, and having generated and multiplied the cases, you see what we are seeing today at the end of September, a surge in number of cases.
Maria Paula, as I said in my introduction, that France has also enacted new restrictions. We're also hearing reports about the number of cases at European universities that are going up. There was a university mentioned in France, the university at Rennes in the west of the country. What can you tell us about the situation there?
Well, after a very strict confinement between mid-March and May, and after the summer holidays, France is now implementing new measures to try to stop the spread of coronavirus. Indeed, many clusters have emerged since French universities opened at the beginning of September. Some of them had to shut down temporarily after some students have been tested positive. So the authorities here decided to divide the country into different alert zones. For example, Paris, its suburbs, and other major cities as Toulouse, Grenoble, Montpellier are considered high alert, which means that gatherings of more than 10 people are forbidden in public places such as beaches and parks. Gyms and reception halls are closed. Bars and restaurants have to close early, maximum 10 p.m. On the other hand, Aix-en-Provence, the southern port city of Marseille, and Guadeloupe at the Caribbean are branded maximum alert zones. In those areas, bars and restaurants are closed since Sunday night for a period of 1 week. And yeah, we have a kind of a new normal already in France with mandatory face masks, temperature checks, hand sanitizer dispensers everywhere. And in most big cities as Paris, you have to use mask even if you are walking on the streets, and the fine if you are caught without a mask is quite expensive, 135 euros.
Right. Bharat, on this question of compliance, of course, the United Kingdom government has introduced these new restrictions, but are people complying?
Half-heartedly, and this is where the importance of timely, prompt, important messages need to be delivered succinctly, and people understand the gravity and the importance of the message. And if we don't deliver those messages in a timely fashion with the sincerity and importance that they deserve, then you will get people saying, I don't think it's that important, and therefore I don't know if I really want to comply. Something else that I have noticed in the United Kingdom is the variability. The variability is amazing, and for somebody who specializes in infectious disease control, I find it amazing that we haven't had clear, absolutely clear, succinct guidelines from the center. What I'm referring to is some people wear visors, and some people wear masks, and some people wear both, and there's variations on how they wear their masks. All of those are messages that need to be corrected immediately, and you have one standard, which is you wear a mask, you wear it properly, and you protect yourself, you protect others.
You know, we have a situation here, Bharat, in the United States where the wearing of masks and practicing social distancing and things like this has been politicized here. Is that a similar situation in the United Kingdom?
Whilst it has not been politicized, we're definitely getting the groups that believe that masks are good, and then there is another group who say, I am going to find every ruse possible to avoid wearing a mask. So to share with our viewers one simple example I noticed a perfectly healthy, perfectly able, perfectly good health person walk into a cafe, and when he was asked to wear a mask, he said, oh, I am exempt. I'm not going to wear one. I don't need to wear one. And he was allowed to carry on with his normal business. I found that unbelievable. And if you magnify that and allow people not to participate in what is a public health action, then we are not being strict enough with managing this outbreak, because we need to sort of say, this is not a political thing, this is an infection control issue, and you've got to take part.
Maria Paula, we were talking about Marseille just a moment ago. There have been protests in that city, and as I said at the beginning of the segment, that business owners are complaining that if they shut down right now, they may not be able to reopen again. So what is the government doing about that?
Yeah, the restrictions provoked protests from local politicians and business owners, especially in Marseille, as you said. They said they already face a very difficult economic situation. Authorities there said they were not consulted. The mayor even asked for a 10-day delay to the new measures, but the French Prime Minister Jean Castex quickly rejected the idea, saying France cannot afford to wait 10 more days, and he does not exclude the possibility of a new confinement if the health situation continues to worsen. However, the government made clear to the bars and cafes that they will benefit from additional assistance. All business affected by these new rules will be exempt from social charges, grants will be available, and all employees will have 100% of their salaries paid by the state. However, what is interesting here in France is that we don't see really this mask backlash as one can see in other European countries. Most French people are resigned. They accepted the measures. And a new poll shows that the majority of French people overwhelmingly are in favor of a new national-wide lockdown in case the coronavirus situation gets worse. While, however, the confidence in the government's ability to face the crisis has never been lower.
Bharat, of course, we are just entering the fall season or autumn season right now. Are there any concerns that the virus could spread even faster in the autumn? Because it also coincides with the flu season.
Yes, there are lots of concerns because in the colder months, we go indoors and we spend more time indoors. And that is the great ingredient for transmission of infections when you are in a crowded place, spending a lot of time indoors. And on top of that, of course, it will also be the start of the influenza season. And of course, you can have perfectly possible dual infections, an influenza infection as well as a coronavirus infection. Therefore, I personally, and the government too, let's be fair to them, have been advising people that you must take your influenza vaccine as soon as possible. Protect yourself against at least something that you can protect yourself against.
Maria Paula, we've also heard from the head of France's National Council of the Order of Doctors, a medical organization. They warned that this new wave, or this new increase that we see in France, will place a very heavy burden on the French healthcare system. He said healthcare workers, to use his words, who were responsible for the spring miracle, as he called it, are exhausted and traumatized. How serious is that?
Yes, the doctors said this weekend the second wave of coronavirus is arriving in France faster than we thought. So just to give you a figure, over the last 24 hours, 11,000 new cases of COVID-19 were recorded in France. The new measures were taken especially because here in Paris, the hospital system is under great strain, according to the Minister of Health, Mr. Olivier Véran. The number of coronavirus patients in the capital just rose from 150 to 330 in the last 3 weeks, and it's expected to reach 600 by the end of this month. Until now, just to finish, 31,700 people died in France from coronavirus.
Okay, and that's where we have to leave it. Thanks to both of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.